You can hear more of my interview with former Representative Baldonado on our website, newmexicoinfocus.org. Also, we should mention the Valencia County Commission named Brian Baca as Mr. Baldonado's roundhouse replacement earlier this week. A Los Lunas school administrator, Mr. Baca will serve out the remainder of Mr. Baldonado's term and can run for the seat in this year's November election. Now, COVID-19 remains a major concern around the state and country. We told you last week the Department of Health says the new variant is 3 times more transmissible than Delta. It has a lower hospitalization rate, but with so many more people expected to catch it in such a short period of time, hospitals are feeling the impact. New Mexico's 2 largest health systems held a joint briefing earlier this week to lay out exactly how they expect the Omicron surge to impact their staff in the next couple of weeks. Those healthcare leaders are warning this surge will impact emergency room wait times, and they are asking people with minor to moderate issues to call a primary care doctor first before heading to the ER. Now, how disheartening, Michael, is it to hear these warnings yet again?
Well, I mean, I think anybody who's aware of the impact of viruses knows that this is a long-term.
Yep.
This is not a quick. There's no quick fix, and any opportunity we might have had to have minimized the impact of COVID. That time passed a number of years back when we might have had the opportunity had we really emphasized vaccinations early on and made a real effort to ensure that did take place. But given where we're at right now, I think that this is a long-term. Viruses are out there. We've altered the environment in so many ways that's impacting the increase of viruses and the potential transmission from across the globe. Mm-hmm. So that's what's brought us to this point. And of course, in New Mexico, we had the highest November number of deaths were 4,246 cases, mm-hmm. And that was that in November in 2020 that was the high of 3,675. So we've had that many deaths. And I think the other thing that really needs to be emphasized is that there are 2 populations that are really being impacted in terms of that's reflected in this death rate, and that is seniors and people with co-occurring conditions, mm-hmm. or underlying conditions. And I would say that we need to reframe and watch our language sometimes, because to me, what underlying conditions means to me is people who are poor and people who are come from ethnic communities. That is an underlying condition, and poverty is an underlying condition. It's more than just, the condition itself, being diabetic, being overweight. Well, what really underlies those what are the situations and circumstances that oftentimes lead people to those conditions? Mm-hmm. And we need to focus on that, mm-hmm. the environment, what's going on, what sort of infrastructure do we have to promote health versus illness?
Right. That's a good point there. Hey, Tom, if you're looking at daily case count updates, I know you are, we all are, you've noticed a significant spike in recent weeks following the holidays. Some of the 24-hour periods reporting nearly 3,000 new cases. Super high numbers. Michael mentioned it as well. But here is my question. Is it time to reframe what they actually mean in terms of impact? Because that's sort of a question right now.
It's an interesting question. When on the holidays in general, I think it's good for people to connect. I think you just need to be able to connect safely, right, and in a responsible manner. When I look at the numbers, and the numbers are just, really, quite phenomenal. But, 92% of the fatalities that Michael had referenced are the unvaccinated. Mm-hmm. Unvaccinated also make up 60% of the overall medical cases. And 83% of hospitalizations. So, I think the larger questions that are going to start to surface as all the hospitals start to grapple, actually not, they're in the midst of it right now, mm-hmm. is, should care be altered based on vaccination status? As an approach to providing care to patients, should we start seeing triage? start to come up, where care should be triaged to help those who have the greatest chance of survival. I hope the answer to all those questions is no. Let's just keep treating, which I know all the doctors and medical personnel want to do. But if the emergency rooms keep getting pounded like they're getting pounded right now, those are very difficult questions, which could be asked here very soon.
Interestingly, the Presbyterian Chief Medical Officer, Dr. Jason Mitchell, Tom, made that very point, saying, guys, it's about vaccinations at this point. It's really not about much else after that. Martha, here's a question for you. I know you're in Santa Fe, but the city of Albuquerque got some backlash after it announced here it was considering a vaccine mandate for all public employees. And Mayor Keller has since clarified a little bit, saying those workers will either need to be vaccinated or test for the virus each week. And so critics of a requirement say it could force workers to leave already understaffed city services. Is that a legit concern?
Well, they're going to have to leave if they get COVID.
Point taken.
I say that I agree with Michael about there is a variety of underlying conditions. Right now, the biggest underlying condition contributing to this pandemic is non-vaccination. And we need to just say that and say it out loud.
Right.
And Barry Ramos did say it to the media last week. Dr. Ramos, very well respected. He just put it right where it belongs, on the backs of the unvaccinated. They are counting on the rest of us who are vaccinated to keep them safe. Is that, when you talk about triage, maybe that ought to go into the mix. I'm pretty much a hardliner on this. I have a friend whose husband not only is an anti-vaxxer, he says COVID does not exist. And this is an educated person, professional that ought to know better. But here's a proposition. See what you think of this. Maybe one way to cut down on the number, and Tom is right, 90% of the hospitalizations and deaths, close to 90, are now the unvaccinated. Maybe the insurance companies should start saying, if you're not vaccinated, we're not covering if you have to go to the hospital. That can change some behavior right quick.
Right. Interesting points there. Michael, I mean, this variant is so fast spreading, people are testing more often. It's getting harder for individuals to find tests. Have you had to navigate this, or anybody you know of? Because CVS and Walgreens have appointments booked more than a week out. And if you go to the Department of Health website for New Mexico, boy, it is awfully tough to find it. Are you hearing the same thing?
Well, I'm hearing from some of my friends nationally. Yeah. For example, in D.C., a friend who contracted COVID, and he can't get to a test. It's not possible.
Yep, that's right.
And I think there are a number of places across the country that are facing the same challenge. The tests are not as readily available as they should be, as they need to be. But I want to pick up on just one quick point, backing up a little bit, and that is that when our systems, when our healthcare systems, our hospitals, and our providers are pushed to the end, to the brink, and those systems potentially could collapse, then I think we need to really think about, going back to Martha's point about and Tom's point about triaging, because if this continues to impact the healthcare system, there may be a need to say, to follow up on the points that they made, that we cannot risk the whole healthcare system collapsing, because there are folks who are unwilling to get vaccinated, because they're not just putting themselves at risk, they're putting everyone at risk, and they're threatening the collapse of our healthcare system potentially.
Hey, Tom, real quick, Santa Fe Public Schools announced plans to go back temporarily to all virtual learning in hopes of getting a grasp on all this. Should other school systems be following suit at this point?
I think based on what the vaccination, status is, but also what the infection rates are, I think, schools need to address on a case-by-case basis. I think the New Mexico Public Education Department is recognizing that there's a significant issue at play on the amount of time you need to quarantine. And so the PED has moved it from 10 days to 5 days for students and staff. And I think that's a step in the right direction.
Good point there. That's a little bit of nuance. I'm glad we got in there. Thank you all for your thoughts on that issue. I know we all wish we could avoid it, but the reality is here to stay, and we need to do what we can to ease the burden on our healthcare workers, among others.